Hello, Diaz here, founder owner Greenwood Dental. Welcome back to another episode. Today I'm discussing the fact that whether you would need to replace a tooth with an implant. Since we are dropping implants in pretty much all three offices through our brand, a lot of these questions are coming up by patient or from patients. So there's no straight answer, as I always say. There is definitely an indication and a requirement for whether we need to replace a tooth that was lost, especially if the tooth has been sitting between two other teeth. Now, one needs to understand that in order to maintain the bone of that site when you remove the tooth, you need to place something in there to preserve the bone. Otherwise, as you guys continue to chew on that area, you will stimulate the bone to recede, melt down, thin out, and also as a result, bone loss. So if you have a tooth that's missing between two teeth and you wait X amount of time for any reason whatsoever, then you are going to be facing the challenge of whether we have enough bone for an implant whenever you guys are ready. That bone needs to be evaluated. That bone needs to be imaged by CBCT or 3D imaging in order to find out if we have the right width and the right height to drop an implant in the bone. There are certain criteria that we're looking for in the bone in order for us to drop an implant. Now, if you decide not to place an implant and leave that space open, a couple things can happen. When and how long would it take for that to happen? It's unpredictable, and we cannot be able to calculate exactly when will be a good time for you guys to drop an implant, because everybody is different. Everybody's habits are different. Everybody's chewing patterns are different. Everybody puts different forces on the teeth than others. And also, everybody, their value as far as for an implant is different, and their priorities are different too. So again, number one is to preserve bone. Number two is to keep the teeth from drifting towards each other. The space will close with time. How fast and how slow, again, it depends on your physiology. It depends on how you are built. It depends on your habits. Dropping an implant between the two teeth, it will preserve your bone and it will keep the teeth from shifting. Also, as the teeth shift and continue to shift, the bone between them, it will definitely sag and will drop. So the force of the surrounding teeth shifting towards that space also will stimulate the bone to melt away, and you're going to lose more bone. Again, there is no right time to drop an implant. It has to do with so many different factors we have to consider, and it will play into the equation as far as how much bone are you going to lose. Now, losing bone or getting to the point that you cannot live with that space and you need to add bone, it will be evaluated. And yes, we can pack bone and add bone, but also depending on how you heal and how your original bone and existing bone will accept the new bone and integrate with that bone to fill out that space that we need for an implant. Now, that is the explanation for a tooth between two teeth. If you have a tooth pulled out in the back of the mouth where it's not surrounded by teeth, or you have one side only has a tooth and it's the end of the jaw or the end of the arch, sometimes or most of the time I have to say, patient, don't miss that tooth, and as a result will not invest in an implant, which is okay. And I always tell the patient that if you miss it, replace it. If you don't miss it, don't replace it. Don't invest your money in something that you are not going to value or not consider important. So that's it for today. I hope that helps. And I hope that answers some of the questions that you guys have as far as like when and how. and give you a better idea in order to make the right decision for you. So we love you, be safe, and DS out.